Hi guys, my name is Brittany and I will be talking to you guys about a very rare condition called a Chiari malformation. I'll pretty much just be going through what it is, how it's developed, what it looks like, what it feels like, some treatment options, and then we'll go through a quick case study of a patient that has it. So a Chiari malformation, or sometimes called a CM, is a structure defect of the cerebellum. And the cerebellum is the part of the brain that controls balance and coordination and some responsible for some muscle activity. And it sits just at the base of the skull, just above the opening. And in a CM, what happens is the tonsils of the cerebellum go down into that opening, and it blocks the cerebrospinal fluid from effectively traveling through the brain and spinal cord. And due to some of that blockage, the cerebrospinal fluid will build up and cause what is also called a syringomyelia, which are fluid-filled cysts that kind of build up and block the spinal cord. And there are different types of Chiari malformations based on how these form, but we'll be focusing on type 2, which is the Arnold-Chiari malformation. So causes of this, normally, as you can see in the picture below on the left side, the normal brain, the tonsils of the cerebellum sit just above the opening, which is labeled the foramen magnum. And in a defective brain or skull, it'll be shaped smaller than normal or misshapen. And as you see it in the picture on the right, the tonsils of the cerebellum go down into that opening. And then you see the shrinks or fluid-filled cysts that are the syringomyelia. And normally this can develop during fetal development, but it can also be congenital or genetic. But it can also be acquired due to maybe past surgeries or conditions where there was excessive draining of the cerebrospinal fluid. As far as risk factors, causes of this disorder is still unknown, but it's seen mostly in overweight women of childbearing age. So of course, obesity, sex, and age will be important risk factors to look out for, but also family history can be included. Past surgeries, of course, due to the excessive draining of the cerebrospinal fluid. And there are some studies going around trying to see if this condition is related to head trauma. So we'll see, like within the next couple of years, what new risk factors might develop. So as far as symptoms, headaches are going to be the most prominent symptom that you'll see. And that's due to a lot of that buildup in the base of the skull. And other symptoms include neck pain, since that's where the central malformation is. Some people will experience dizziness and syncope, which is fainting. They can experience balance and visual issues, so maybe temporary blindness or just blurry vision. They'll experience muscle weakness and numbness, maybe sometimes tingling. And then some people also have trouble with hand coordination and fine motor skills. And as far as management and treatment, some people actually don't experience symptoms at all. But for those that do, treatment is based on the severity of it. So in the case of mild symptoms, which will be just headaches or maybe other simple body pains, doctors might prescribe medications or physical therapy or other lifestyle changes that pretty much are just avoiding activity that include any heavy lifting or anything that'll put stress on the neck and spinal area. And as far as severe symptoms, those are going to be anything that affects activities of daily living. And, sorry, in that case, it'll require surgery to treat. And there are a couple of different surgeries that can be done, but most importantly, a shunt will be inserted if a shunt isn't already in place to control the drainage of fluid. And a shunt pretty much will be inserted into the area where the fluid buildup is, and then it'll be drained either to the chest cavity or the abdomen for reabsorption, and that'll relieve a lot of the pressure that builds up in the head. And then you have the posterior fossa decompression, which in that case they'll pretty much remove a piece of the skull and back, and maybe even a piece of the spinal cord, and that'll create space for the cerebellum to kind of sit comfortably and release a lot of pressure that way. So for the case study, we have a 19-year-old female, again in that childbearing age. She has Chiari-2. Her BMI is 32, so again, in that obesity range, which is also a risk factor. But other than that, her total cholesterol is pretty normal at 180 milligrams per deciliter, and her blood glucose is also in a normal range of 85 milligrams per deciliter. As far as other risk factors, she doesn't have any family history of this. She's not a smoker. She was moderately active before her symptoms got really bad and kind of had her kind of sitting out on everything. But she also did have a couple past surgeries where she had shunts inserted. But she is no longer on medications for that at the moment. So as far as exercise, exercise is only recommended for people who experience little or no symptoms at all. If you experience a lot of symptoms, we recommend you to not exercise. And when thinking about intensities for exercise, we want to focus on RPE instead of the basic and required intensities, because if you are experiencing little symptoms, they might cause some intensities to feel worse than others. So for aerobic, we suggest 3 to 5 days to start, at least 10 to 20 minutes just to get used to working out again and being active. Things to do are like light walking, slow walking, but for people that aren't comfortable with doing a lot of weight-bearing exercises, they can do aquatic exercises or like walking in the pool. As far as strength, we want to say 2 to 3 days, 1 to 2 sets, 8 to 10 reps with light or no weights. Again, we don't want to put any extra pressure or stress on the neck and spinal area. And we also want to avoid any overhead exercises. So things to do could be like sit-to-stands or basic arm curls, really anything that'll get your muscles moving. As far as balance, this is what you kind of want to do the most, since that's the area of the brain that is affected. So you say 5 to 7 days. Really, it's subjective on how long you do it, because again, symptoms can cause you to get dizzy. So we suggest what's called the Brandt Daroff, and I have that picture on the bottom left there. So what you'll do is sit on the edge of the bed, and you'll lean to one side and turn your head upwards until you're looking at the ceiling. And you'll hold that position for about 5 seconds or so. And then you'll return to normal seated position and repeat on the other side. And again, time is subjective depending on how the patient feels. And then on the bottom right there, I have just a picture of a simple cervical exercise, which is good to relieve headaches. So it'll just be your basic slow side to side head turns. And that'll relieve a lot of the tension in the neck and help ease headaches. And for things to consider when exercising, again, we don't want to put any extra strain or stress on the neck or spinal area. We want to wear highly cushioned shoes that'll kind of help balance out that weight distribution in those areas. Most importantly, you want to take frequent breaks because you will get tired easily due to long periods of inactivity during recovery. And when you're exercising, you want to stop immediately if you ever start feeling dizzy, if you ever get a headache. You just want to stop what you're doing and rest. And on days that you're not feeling too sure about exercising, or if you're experiencing even a little symptoms, you don't want to exercise at all. And we're at the end of the presentation. Again, this is a very rare disorder and not a lot of research has been done yet, but I was fortunate to find a couple sites that really explain well what happens in a Chiari malformation. But what I found most helpful was all the way at the bottom there, I have the Chiari Syringomyelia Foundation, and that website is basically Google for the Chiari malformation. Like, it tells you everything you need to know, what it is, extra symptoms, and it even goes into depth about the other types that can occur. And it also has a couple links for research that has been done and research that's going on now. So if you guys ever get a chance to check it out, you should definitely do so. But that's the end of my presentation, and I thank you all for watching.